Hello everybody, it's Dr. Galvin with Sunday's coronavirus update. Today is April 5th, I believe. Yes, April 5th. Sunday, current numbers, 1.2 million cases worldwide, 67,000 deaths, 252,000 recoveries. In the US, 312,000 cases, 9,100 deaths, and about 15,000 people recovering. Remember, the recoveries certainly lag the cases because it takes about 2 weeks to get through this. Here in North Carolina, 2,585 cases, 31 deaths. Interesting information out of the Department of Health today in terms of North Carolina. About 50% of the cases that have tested positive have been between 18 and 49 years old, so fairly young. But 85% of the deaths in this state have been in those over 65 years old. So remember, lots of people are going to get this. Like we keep saying, most people are going to have relatively mild disease. They're not going to die from it. But we add in those risks, we add in age and other things, and those rates go up. One of the topics I want to cover today is the virus in pregnancy, because I get asked this question. If I don't get asked this question 5 times a day by somebody, I feel like I've missed something. So if you're pregnant, you want to get pregnant, or you just had a baby, what are the risks? And obviously it's a big concern. There's been a number of studies out. There was one in Lancet, which is a British medical journal that came out in February, where they looked at 9 females that were positive, that were sick with the virus when they delivered by C-section, and none of those babies were ever tested positive. There's been a number of studies in the Journal of the American Medical Association, as well as some case reports that are interesting. There is a study where they had 33 births to mothers that were positive, and I think 3 of those children subsequently developed the illness, although a very mild form. They did fine. They did not have any problems at all. There was one case report of a woman that had the virus, and when the baby was born, the baby had antibodies against the virus and never developed sickness at all, but it looks like may have developed some sort of an immunity in utero, or had some kind of exposure in utero. That's one case, not really much to go on, just a case report. We know that data out of China, very tiny number of children died, maybe 2, I think, in the entire Chinese experience so far. I think there's been 1 6-week-old that's died in the US, and you always wonder with a 6-week-old what other problems were going on. So I would bet you that wasn't primarily a COVID problem, but probably a sick baby that died that happened to get COVID. So I think that generally if you're pregnant and you follow the precautions we talked about, you're going to be fine, and your baby's going to be fine. And I want you to, pregnancy is stressful enough. You don't need more things to worry about. I think this is one thing that you can put like maybe down in the very low part of your worry list. In terms of the medical care, people have asked me, what's going on locally? We're seeing more cases, and we're seeing sicker cases, and we're seeing some very messy intubations that are very scary for us in the emergency department. It's probably the highest risk thing that we can do is to intubate a patient. Now, we throw that word around a lot, and I realize that my level of angst with that word may be different than your level of angst. In emergency medicine, it is a life or death decision. When we decide to put a breathing tube and take over somebody's breathing, it requires us to completely sedate and paralyze that person. So once we make that step, and once we do that, that person will stop breathing and will not breathe unless we do it for them. So if I don't get that tube in, they're going to die. Now, sometimes we can bag people externally, but sometimes we can't. So when that decision tree is made and we follow that, we decide, I never make that decision lightly. And these particular intubations on COVID patients are very difficult. There's lots of secretions. The intubation itself is technically challenging, and it's high risk. That stuff is getting aerosolized. Not only am I getting exposed, but my respiratory therapists, my nurses, my techs, the paramedics that brought the patient in. That room is basically a giant viral, cloud probably. So we're trying to use all these masks and shields and stuff that we don't have enough of. We're trying to use as much as possible a video device to assist it, so we don't have to get our heads right down in the patient's face while we're doing it, because we have to look. So we're trying to use some video assisted devices. We have some race teams and some other companies locally that are trying to build us these plexiglass boxes that will kind of protect us a little bit, but it makes it difficult to do the interventions that are necessary, so we're still working through that. But that process is very difficult, and it is a high anxiety thing for those involved and very risky. And it brings us to some ethical questions. And one of those ethical questions is, what do we do about people that are in cardiac arrest out in the field? Now, if you have a cardiac arrest and the ambulance gets there and you don't have any pulse, and they're going to start CPR and either intubating you in the field or bag valve masking you, then if you happen to have COVID, you're going to expose that crew pretty severely. When you come to the hospital, you're going to expose everybody else as well. That is that's understandable. If we can save somebody's life, we're going to do everything we can to save somebody's life. But the hard fact of the matter is that those out of hospital cardiac arrests have an extremely low survival rate, probably less than 1%. So 99% of the time, that person is not going to survive. We're going to go through all this stuff. We're going to intubate them. We're going to expose everybody for 15, 20 minutes, and we're going to call the code, and it's over with. And I think we're going to have to start making some ethical questions about whether the utility of doing these life-saving measures on what is very, very likely a completely futile effort, is it worth exposing 15 people or so to this virus, where they could give it to somebody else, and we might end up with one or two either severely ill people or deaths related to somebody that had a 1 in 100 chance of surviving. And luckily, those are not questions we're having to directly make now, but I think they are going to be questions that we're going to have to start thinking about. When people come in without a do not resuscitate order or a living will, we don't know what to do, so we do everything. And so people that do not have what we call return of spontaneous circulation, ROSC, in the field, those are highly dangerous to our staffs and the physicians and the nurses and respiratory therapists. And is it worthwhile to go through these things for cases that are likely futile? And again, I'm not saying what we're doing, whether we've made any decisions, but it's something that as these numbers go up, we've got to think about. Remember, there's a lot of people that think the death rates are much higher, that people are dying of, at home of so-called natural causes that are probably related to this. And so some of those cardiac arrests are probably people that have COVID that are arresting at home, and then this is happening. I know it's kind of a bummer. I know nobody likes to talk about death, but it is a realistic thought, and it's a realistic thing that we have to really consider, because we've got to do what's best for the patients. At the same time, we have to protect our staff as well. And those are going to be hard decisions we're going to have to make. In terms of numbers of deaths, the Trump administration is touting 100,000 to 240,000 deaths in the U.S., and the Surgeon General is talking about our Pearl Harbor moment. And it sounds, very horrible, but as a light of, a little bit of a ray of sunshine, the Gates Foundation and Bill Gates, they are somewhat in disagreement with those numbers, and they feel that the numbers could be far lower if we continue practicing social distancing, self-quarantining, and things along those lines. We may be able to lower that number significantly, and I think that's beneficial, so we've got to do it. However, driving here to the office, I had to come in for something, and there's Sunday, the highways are packed. I drove by a Target, the parking lot is packed. I drove by another Lowe's, the parking lot's packed. I see maybe 1 in 5 people wearing masks. So if we continue to get out there and we don't take some precautions, these numbers are going to keep going up. And I think if you're going to go out, wear a mask, not to protect you from breathing the virus in, but if you've got it and don't have any symptoms, to protect you from giving it to other people. I keep getting asked about antibody tests. I was sick a month ago, 2 months ago, 3 months ago. Did I have it? Can I get tested for it? The answer has been pretty much no, but there's always a but, right? FDA did just approve an antibody test this week. What does that mean? Well, what that means is that they have a test that they can actually see if people have been exposed previously. Can you go out and get this test? No, you can't. But the CDC is starting to use it in New York, and I think 2 or 3 other cities that are less hard hit to do surveillance to figure out how prevalent is it that people may have had infections in late January, early February that may have been COVID that have been really, really mild. And so they'll utilize that data to give us some guidance. Those tests may well become more broadly available. They are not available right now. I'm going to end here. We're going to come back tomorrow with more. Leave questions below and I will try to answer them. A couple things. If you like this, please give us a like on Facebook or share the post or follow us so you get updates when we post. The other thing is I'm going to be on WCNC with Carolyn Bruck sort of virtually this week doing what was probably going to become a weekly story of answering questions as well. I will be back tomorrow. Everybody be careful, wash your hands, take care of yourselves, take care of everybody around you and your families. We're going to get through this. Deep breath. I'll talk to you tomorrow, okay?